Welcome everyone, Croeso pawb, and we're going to kick off today's Digital Governance and Safety Committee subcommittee meeting for the board. As usual, welcome everyone. In the interest of time, I'm not going to go around and ask for introductions, but if you could introduce yourself when you first speak, that would be great. We are being recorded. This is available on the DHCW website afterwards. And for members of the public, it's helpful, and you get to call me out on this, if we can try and avoid jargon and three-letter acronyms, or TLAs, as I sometimes call them. There will be a private session at the end of this meeting where we'll discuss matters relating to information security mainly, where we wouldn't want some of the discussions to be in the public domain where bad actors might benefit from that information. But as usual, there'll be a summary of that meeting, which will also be made available at the next meeting. Those minutes will be approved and they'll be available on the website. The committee papers are also uploaded on the website. Committee members may be glancing down at papers from time to time, so please forgive them for that. And we are going to try and take a 10-minute break. So the public part of the meeting is scheduled to run until 5:05, and then we'll take a 10-minute break then. So if I can move to the formal parts of the meeting, are there any declarations of interest that I need to be made aware of? No? Excellent. Shaking of head. Everyone's good. And are there any matters arising that I need to add to today's agenda? Any AOB? No? Good, because we've got a busy agenda. So let's move to the consent agenda and the minutes of the last meeting. So can I ask the committee to, firstly, are there any comments on the minutes of the public meeting? And therefore, can I ask for your approval by show of thumbs up? Okay, excellent, thank you. And similarly, the private abridged minutes, are there any comments on those? No, okay, and can I take those as approved? Excellent, thank you very much. So with that, we'll move to the main agenda. The action log had two actions from the last public meeting, and I see those were both completed, so thank you very much for that. And therefore we'll move to point 3.2, which is a discussion of the corporate risk register. And that's to be led by Chris Darling. Hello, Chris.
Hi, Chair. Thank you very much. I'm Chris Darling, Board Secretary for DHCW. Just going to run through, Chair, the current position from a corporate risk perspective, focusing on the risks assigned to this committee. So there's currently 18 corporate risks on the risk register. There are 8 assigned to this committee. 3, as you set out earlier, are private, so they will go to the private session and also relate to information security. So the 5 risks relating to this committee that are assigned in public session, I'm just going to run through and get an update on the current status. The first 2, I'm going to ask my colleague Darren Lloyd to come in on, 0263 and 0320. Darren, if you don't mind taking them together, I know they're interlinked, but there's a lot that has been going on from an information governance perspective across the system over the last few months. So if you could just update on that in the context of these risks, please.
Yep, certainly, no problem. I'm Darren Lloyd, I'm the Associate Director for Information Governance and Patient Safety. Good afternoon, everybody. Yeah, so these are long-standing risks, as the committee will be aware. I've been on the corporate risk register for some considerable amount of time, and they assert our responsibility both from a functional perspective to understand our information responsibilities and ensuring that we've got the appropriate lawful cover in order to do the things that we need to do with Welsh resident information, and the requirement, or at least the assurance that we're doing that with the cover from those with the responsibility for giving that to us, i.e. Welsh Government. And so understanding our full functions within our organisation, our statutory functions, to be that organisation that assists in the provision of data in terms of the collection, processing and dissemination of that. And I think it is fair to say there's been some challenges in terms of the system and ourselves understanding those functions and having the cover in order to create an environment where we have higher capacity for data and that incoming information required to do those really important things around achieving value in health, achieving understanding patient pathways, those type of things. So so those functions are really important in terms of reducing any ambiguity in the system, both from a government perspective and from a statutory organisation and a wider service perspective. So that work's ongoing. There is more clarity in the system, I would suggest now, in terms of aspects of other work that's been done. Statement of intent, a statement of intent piece of work has been done by Welsh Government. Our remit letter, as the committee may know, that DHCW has been furnished with a remit letter from Welsh Government that puts a lot of emphasis on data and some of those functional elements within inside the organisation, and some high-level correspondence as well in government in terms of the need to provide the clarity into the system. The risk has gone up because there are, as has been alluded to previously, there are a lot of dependencies on ensuring these things, this clarity is in the system of the larger programs of work where data is absolutely inherent in our roles and role and responsibility. So it is at the highest level within our corporate risk register and is there for a reason. But the partnership working between us as an organisation and Welsh Government is key, and actually to getting some of this over the line. Together with that is the other risk, associated risk, is about the transparency element, which is equally important, and the ability to ensure that the system and, more importantly, the public are fully aware of how that information from the NHS and from the wider health and social care environment is being used to improve the service effectively.
Thank you, Darren. And Darren, just might be worth mentioning that I think committee members will be aware these risks aren't going to be mitigated by DHCW alone, because they involve a number of partners. And there's been a number of publications, as you mentioned, the remit letter, also the Ministerial Advisory Group on Performance and Productivity. There are explicitly some reference to information governance, particularly around how that will flow into the national data resource, which I think is helpful, but also probably gives the context to why the risk scores increased. You know, it's seen across the system as a critical place now to have clarity on. Is there anything you want to add on that, Darren?
Yes, and I think the context sometimes switches between the technology and the organisation. But inherently, it has to rest with the statutory organisation having those functions, not necessarily the technology. It will have a technological function, don't get me wrong, but it's the statutory function which is absolutely inherent and important in that decision making. Sometimes they're used interchangeably, and the language and the narrative is very. It can be confused, but it's very important from our perspective to get it clear. The functions and the statutory responsibilities reside with the organisation itself, which is Digital Health and Care Wales. And so, from an NDR element, even though the narrative is sometimes around the technology stack, it actually means the organisation itself in terms of it lining up its legal basis for doing those things it needs to do with the data. They have to coexist. One cannot operate independent of one another, of the other, effectively.
So Chris, can I just sort of pause there on the risk register to have a discussion of these points, because I think they may well be of interest to external parties. Alistair, you have your hand up. Do you have a question?
Thanks, Rowan. Yeah, and Chris, you partly answered the question I was going to ask about the mitigations that involve other partners, which I think is very good to hear, and I support the the report and note the updates, which are very, very helpful to be so clear and transparent about. My question is partly answered by what you said, but not fully. I wondered, given the importance of the close relationship that we have with the Welsh Government, are they one of the partners who are involved in partly the mitigation, but partly the understanding and recognition of the risks and the way we score them? Are they significantly involved in that? And I just wonder if you could clarify that.
Yeah, I'm happy to, Alistair, and I will let Darren come in if I've missed anything. But I guess the first thing to say on that, yes, Welsh Government are a key partner on this. This particular risk has been highlighted through we have a biannual joint executive team meeting with Welsh Government where we've raised this as a risk from a DHEW perspective, but one that needs system-wide oversight. An update was taken through the Chief Exec Forum by our Chief Executive Helen Thomas a couple of months ago, and I know that following that, a letter from that peer group went into Welsh Government around the need to, agree the way forward, working in partnership with Welsh Government. We're just awaiting a response to that letter, but I think that will be helpful from a collaboration. How do we solve this risk collectively as a system? But I'll let Darren come in because I might have missed something there.
Darren, in your answer, it might be helpful just to remind everyone of this the way GDPR works in this system and the sort of roles of those bodies that can grant authority to process information and why therefore as patient information as it travels around through the system and then how it needs to be protected, who has rights to process it, transmit it, store it, and then also how we use it for other purposes like planning health. I think that would just be helpful.
Okay, I'll just come back. I think, Chris, you covered off most of that in terms of some of the mitigations in order to answer Alistair's question. There are a number of threads that are now running through a lot of the reporting aspects that that are raising the profile of this, and more individuals are getting involved in trying to understand their role and responsibility both inside and outside of government as well. So that's one point. The other element is, of course, is in terms of the law, then we have to satisfy a number of areas of the law before we can process data. That's just a basic thing. And to be honest, and to be clear, this is about processing identifiable information. The law is only engaged when you start processing identifiable information. And of course, DHEW is well in that space because we are responsible for processing 3.2 million Welsh residents' data around the health area. Effectively, the law has to be satisfied on a number of fronts, and one of them is law that is very clear to us, and other law is common law. The common law of actually maintaining the confidentiality of that information. That's the crux of it. Is in any circumstance, even though we've got quite a diverse way that we're using data, that confidentiality expectation from the member of the public has to be met. And so in order to set aside some of that common law aspect and some of that confidentiality in order to inevitably move that data around the system, there are mechanisms to do that. One of them is to use the powers of government in order to say we are setting aside certain aspects of the common law in order to allow you to perform your functions. But that has to have that ministerial level of approval to allow that to happen. What that does then is engage our functions, engages our requirement then to ensure that we do that safely and transparently, and to then have a purpose behind those things so that we as an organisation are doing things that are commensurate with our functions and our responsibility. So we're not operating as it's called ultra vires. It's still within our functions and within our powers. But the law has to be satisfied in order for us to create the processing tasks and then the dissemination tasks out into the service. Now, the dissemination might be aggregate data or fully anonymized information. But our first point of call is the fact that we have to ingest identifiable information to do all of those really important things to get all of those outputs out into the wider service effectively. And that's the challenge. We have to break a few information governance eggs at the start of the process in order to get the outputs and the requirements that we need towards the back end of the process.
And you have to have permission to break the eggs, and you have to be able to justify that it's in the individual's interest.
Yes.
To do that. David, you have your hand up. Sorry.
I do. Thanks, Rowan. Darren, I'm looking at the risk 320, citizens and stakeholder trust in the use of health and social care data, which has increased in risk. The statement alongside it is increased risk due to impact of major programmes, which I'm assuming is a reference to the escalation from Welsh Government. I'm just struggling to understand why that has increased in score just as a result of the escalation, because the escalation has really only just, if anything, brought to light what we already knew before escalation happened. So just help me understand why we think that risk has increased.
That risk increased, David, not as a result of the escalation, but as a result of us moving closer to some of the achievements of the programs that we need to show results on, i.e. the NDR programs, for instance. So we're getting closer to we have our technology stack. We understand in terms of how we move the data and ship it into the technology, but the underlying matter is that the requirement to ingest some of that information is the challenge, and being able to have that conversation with the public. So we're getting closer.
Oh, I see.
Very closer to the point of the fact that we are not deriving the benefits of that program because we're not moving that data into those areas because of that particular challenge. So it's not escalation necessarily. It's the fact that we're moving quite quickly now into that program space and getting achievements from it, but not actually getting over the line because we haven't got the data.
Right. Okay.
So we're planning for delivery, but we can't actually complete without this approval.
So it's bringing into focus the fact that something needs to have happened that hasn't, and we're getting close to the point where we need. Yeah. Okay. I'm with you now. Thank you for that clarification.
Alistair.
Thanks, Ron. And my second question was really on 0320 as well. It was just on a slightly different area, which I wondered whether or not this aspect of citizen and stakeholder trust in the use of data overlaps with security of data and the very obvious escalation in recent weeks in terms of ransomware attacks on major retail organizations, just bringing to the fore the potential for public concern about what data is stored, who holds it, and so on. And I just wondered if this takes any account of that, and whether or not there's any aspect of that we can mitigate. Thanks.
If I don't know whether Mark wants to come in afterwards, but I'll just start that conversation. Obviously, the trust element comes in many different forms, doesn't it? It's not just necessarily the context of this comes in terms of use of, not necessarily the wider context of security of, and all of the other trusted elements that come around that. Of course, it's inherent in what we do that trust does incorporate those things, either from a lawful and a governance perspective, where my responsibilities are, and a patient safety element, but also from a security perspective as well. So that it is a fixed point in terms of that risk. It's about usage and purpose-driven uses of that data, not necessarily the wider trust element, which is equally and it's just as important to actually navigate and to make sure that the public are fully aware of all of those things.
That's a good point. Good point, Alistair. And obviously, we live in a geopolitical context where, firstly, health data is incredibly valuable, which is why it is of interest to bad actors, and why we have Mark. So, Mark, do you want to respond and compliment Darren's answer there?
Yeah, thanks very much, Rowan. I'm Mark Edwards, Chief Information Security Officer for DHCW. Yeah, just to reiterate what Darren said, is that the cybersecurity team are very aware of the recent attacks on retail and other attacks on the health sector, and I will be covering that in detail in the private session.
I think what's useful about this conversation is it's an opportunity just to play out, how the controls operate across the system and within DHCW to have these concerns front and centre. There are aspects of GDPR where, healthcare actually has additional kind of coverage within the Act, so that information is always used for the benefit of the individual. Darren, perhaps, as Chris said, these are long-standing risks on the risk register, and to see them going up is never what we want to see. Can you describe for us the activities, perhaps over the last 12 months, 18 months, of the work that DHCW does to try and get ahead of these issues and engage across the system and with government to have a focus on these matters?
Thanks, Chair. Yeah, so in terms of awareness raising, then we try and create the awareness of the importance of all of this to all parts of the service, whether that be health boards, trust, primary care, secondary or tertiary care, and across public services as well. So the wider framework we've got in terms of our IG framework that responds to the law, as you know, we've got the Wales Accord for sharing personal information. That kind of brings in another facet about how important it is to share data with inside the system as well for the better outcomes of the Welsh residents, etc. So it's multi-layered. So in terms of the service, then we do a huge amount in order to get the understanding of our functions being a huge benefit to the rest of the mechanism within inside the system. The other element as well, of course, is to try and allay any fears that there may be within the system about our role and our functions. But also, there's an element of lobbying in terms of how important it is in order for us to get a proper framework and a proper baseline for us to perform our basic functions. Data is everything. The minister will agree, hopefully, that a lot of the speeches that the minister has been talking about over the last 6 to 12 months has been about a base for good data and data informing how we move things across the system. DHCW is inherent in that. It has to be. All of the other services are also inherent in that. But in terms of having the responsibility for that, we've got to have the fundamentals in place in terms of our functions. So there's an element of making sure the service are aware of their responsibilities, but also helping Welsh Government to understand where there's a policy gap, potentially, where there is interpretation, where that interpretation isn't necessarily helpful, and we need some clarity from a policy position as well. And where DHCW is very willing to help in those areas to provide the clarity, because it is set with inside the service context all the time. It understands the need in some of that policy area where the ambiguities in the system. And it's not through anybody's fault, it's just through time eroding where we need to be and increasing the standards in these areas and making sure that both the service and, of course, those decision makers in government are fully aware of those things.
That's really helpful. Thank you, Darren. Can I ask Chris, is there a sort of timescale for at least seeing this particular risk move down, and when it really needs to be resolved in order that DHCW can meet its ambitions on some of the key programs that it's seeking to deliver?
Yeah, so I mean, this does link into escalation to some extent, because we have got a number of milestones around this as it relates to a number of our major programs, the NDR, the National Data Resource being one of those. but it's not necessarily a milestone for DHCW. Some of that is about what's mandated from government and when it will happen. So, Rowan, what I can do is bring back to the next meeting a kind of audit trail of some of the work we've done working with Darren, and a look ahead to next steps in terms of mitigation, because I think you're right. We need to be clear about this in terms of some of that will be driven by other reports. So I mentioned the Performance and Productivity Ministerial Advisory Group. That's set, I think, a 6-month time frame for resolution. So we can certainly map that out and bring that back if that would be helpful for the committee.
I would absolutely support that, Chris. I think that'd be a really good document and a discussion to have at the next meeting. In the meantime, we will continue to do everything we can to support staff with timely information that ensures safe care, which Riddy and I just say because I've been listening. And Chris, thank you for that discussion. I'd also like Julie to note that for perhaps the report for the board, that to make that discussion a point at the board. Chris, I know I interrupted you. There are a few other risks that you all want to call out.
There are, Chair, thank you. Yeah, the first one, 0300, CANIS screening and palliative care. Again, board members will be very aware of this risk. Unlike the two we've just discussed, this has actually decreased in risk score, but Ridian doesn't want this to come off the risk register at this point until we're in a more certain position. So I'll just ask Ridian to update briefly on this one.
Thank you, Chris. Ridian Hill, Medical Director at Digital Health and Care Wales. CANISC has been a product in a live environment since around 1997. It was on the risk register in the National Informatics Management Board in 2015 as a 20. And we've inherited that program and have been de-escalating the risks associated with the product through moving the functionality from CANISC into other national products. The functionality was initially divided into cancer, palliative care, and screening and colposcopy. The cancer community essentially moved off CANISC over 2 years ago. We are very close and anticipate in Q1 of this cycle that CANISC will be decommissioned from a live environment. This is excellent news, and my thanks has to sort of go out to a number of people, including Alex and Mark, who are well aware of the risks that we hold with this product, and we're making good progress. I want it to stay on the risk register because until we have completely removed all users from this product, I believe that a risk remains. So that's why it's on the register, and the progress that we've made is why the risk has reduced, because the number of users has significantly reduced. Thanks.
Thank you, Riddy, and that's really clear. And I believed I promised everyone scones on that particular programme when CANISC is fully delivered. So we'll have the risk removal party when everyone's finally off the system. Has anyone got any comments on the CANISC update? No, Chris?
Thank you, Rowan. Yeah, just two others that I'd like to just update on. 0336, the Audit Plus withdrawal of contracts. I know this has been to this committee a few times in terms of updates, but just let Rachel Powell update on the current position, if that's okay.
Yeah, thank you. Rachel Powell, Associate Director of Information Intelligence and Research. Yeah, so we have some better news to report, fortunately. So members will be aware for some time we've been in negotiation with Clanwilliam around the contract change note to see if we could extend the contract, and kudos to our procurement and commercial colleagues because there was a lot of negotiation between those teams to try and put that in place. So thankfully, that is now, it has all been signed by the relevant parties, and the contract remains in place until the end of April 2026. So I think going forward, this committee will see a slight change in the way that we articulate that risk, because whilst we have that extension of the contract, and that's really good news, although we do appreciate it's still not as robust as it perhaps has been in former years. The work that we're now laser focused on is a replacement and building something in-house to ultimately replace the current Audit Plus solution that we have. So the work that the teams are actively trying to support now is developing something in the NDR environment, ties in really well with what Darren was saying in respect of where legal responsibilities in that space. And I think NDR colleagues would echo that whilst technically we have a relatively sound solution in that space, there's a lot of things we need to unpick from a legal and IG perspective. And actually the Audit Plus problem, if you like, what we've been unpicking and unraveling, and we've mentioned this on a number of occasions, that tool's developed over a number of years, and there's a lot of reliance being placed on it to do more than what it was originally procured for. So actually in tackling the original Audit Plus tool, we're looking at quite a lot of future requests for potentially accessing primary care data, and as such we need to ensure that we get the primary care data acquisition right, have all the right legal things in place, and then ensure we've got the appropriate use cases to do what we need to do. So that as I say, the risk will change slightly. So really positive that we've managed to extend, and through a lot of painful negotiation with Clanwilliam, extend to the current Audit Plus solution to the end of April next year. But yeah, the current focus is on how we can develop a replacement in-house solution.
David?
Yeah, thanks, Rowan. Thanks for that update, Rachel. Great that we've got a solution to the problem. Just wanted some reassurance, if you can, around the timescale we've got to have to develop it in before Audit Plus gets switched off, and whether the plan we might have for that development fits nicely within that, or we've got a bit of a critical path around it.
Well, we have that very that sharp date of the end of April 2026 to work towards, and something that we're discussing in-house now is how we can put more formal arrangements around that in-house solution project. It does depend on a lot of different teams and a lot of different input, and there's a lot of dependencies, as I say, because whilst we might unblock something from a technical perspective, if we don't have the legal permissions in place, it simply won't work. So there's quite a lot of input and dependencies across a multitude of teams. And one of the discussions we're having next week, I think, internally, is how we can put that formal governance wrap around it and formal project arrangement to do exactly what you said, come up with a plan. We have something fairly high level, and teams have been working towards that. We've done a lot of discovery and a lot of piloting. So I know the NDR team have taken a test data dump from EMIS into that repository to work out, can we grab the data from those systems? And the answer is yes, but that's been very testy so far, and it's not quite the data that we need. So yeah, we need to refine some of that plan and to be a little bit more transparent and accountable in terms of the different teams' efforts to that, so that we're all collectively working on the same plan. And that will require some prioritization of work and potentially some additional resource, as well as, this has been bolted on to teams to try and pick up in the event of Audit Plus just abruptly being switched off, which obviously was a real threat this year. So great that we've got that breathing space, if you like, although we're always quick to point out it's not a lot of time to develop a brand new solution. So we continue to look at other things as well in that period. And obviously it's also worth flagging there's a lot of external factors that are compounding the issue with regards to the migration from the vision systems onto EMIS as well. So there's so many things in the mix, and a little bit of time is helpful, but we're still working to the event that we don't have a solution from the end of April.
Okay, thanks.
So thank you, Rachel, for that update. Good that we have certainty that we've got this breathing space. Clearly a lot to do. Thank you, Michelle, and your team for what was a very challenging conversation, and thank the supplier as well that they've been able to accommodate us. It's a really important functionality, but one of those sort of little legacy critical component functionality that just builds up in these complex systems over time and leaves a big hole if it's switched off. Chris, is that?
There's just one more, Chair.
I thought there was one more. I was
Yeah.
doing my counting.
Thank you. No, there's just one more, 0340, which has come onto the risk register, fairly critical. The GP systems and service provided by third party could be withdrawn. And I'm going to hand to Michelle to update on this, with the caveat that there are clearly some commercial sensitivities and discussions going on, but I know Michelle will be able to give an update in this public forum for everyone. Thank you.
Without the use of mime, ideally.
Thank you, Chris, and thank you, Rowan. I'm suitably motivated by the suggestion of scones earlier, Rowan, so I'm happy to do anything I can. So this is obviously this is an important area because it relates to one of our GP systems, which is operating currently in just under half of our practices across Wales. So there is a risk to service continuity that we're managing. Now, probably the first thing to point out is that this service is continuing to run, operate and perform in the way that we would expect, so that we are not currently managing an impact on service provision. So that's, I think, is really important. There is a risk and we're managing that risk. We're in regular communication with our GP practices and with other key stakeholders so that they understand where we are and how we're supporting them through this. And there are a number of contingency plans, I think it would be fair to say, that have been established by the Task and Finish Group and are in place in the event that we need to invoke them. We would hope not. The main plan, in order to address the current issues that we're managing with INPS, I would hope we would be in a much clearer position by the end of June. So this is a process that we're going through at the moment, and we are hoping that we can get this to resolution by the end of June, in which point we would be in a much clearer position, and we would certainly be able to reduce the level of this risk, if not remove it entirely. So as I say, that risk remains currently, but we have got a group of people who are very focused on getting us to a resolution as quickly as possible.
Thank you, Michelle. Chair, that's the risks assigned to the committee that I wanted to make sure we had the opportunity to go through an update on. My final point I just wanted to make, and it's something that you had raised actually informally outside of the committee setting, was just about standards and adherence to standards, and perhaps something we come back to once we've gone through the assurance reports from a risk perspective around standards. But so not directly linked to this, not on the risk register, but just something I wanted to mention.
Okay, Chris, we'll have that conversation. Just some thoughts at the end of today. So there is a little AOB that's snuck on that didn't get called out earlier. So Julie, if you can make a note of that and remind me at the end of the meeting. In which case, thank you for that, Chris, and I'm delighted to move on to the assurance agenda, and to lead us off, Keith, I'm going to invite you to take us through the incident review and learning report, please.
Thank you, Chair. So I'm Keith Reeves. I'm Service Management Team Manager with Digital Health and Care Wales. So the report's been circulated prior to the meeting. It's a combination report, so it covers Q4 of 2024-2025, plus also a summary of the overall year. And really, I mean, from this report, I think the format hasn't really changed much on previous quarters. So we're now entering our 5th year of the group, and we're still making a lot of inroads into embedding learning within the organisation. Part of the remit of the group, and it's something that I'll probably cover off just at the end, is that every year we do a reflections exercise by undertaking a SWOT analysis for the effectiveness. We did undertake that in April, so I'll do a highlight at the end of the report. I'll provide more detail in the Q1 report, which will come to the next meeting. So just working through the report itself, in the usual order, so starting off with the reporting. In Q4, we had a generally probably tempting fate here, but a relatively quiet quarter. We had one early warning notification, which was issued in relation to people in organisational development. That brought us to a total of 6 notifications across the year. This was a drop on last year, where we reported 9. For complaints, concerns, and feedback, again, there was an increase on quarter 4 from 37 in quarter 3 up to 72. A lot of these are still related to the NHS Wales app, and as a sort of culmination of all of that and the inquiries themselves, we had a very, very busy year with the sort of formal complaints, concerns, and feedback. Now the corporate governance team, they do submit an annual complaints return, so there's more analysis that's been undertaken in that report. But I think generally speaking, I think the way that we've been heading, I think the concerns that have been raised, or the inquiries that have been raised around the app themselves, we're getting through some of the implementation of the technical solutions, which should then help to reduce those inquiries coming through. So we've implemented things like the identity verification service. So hopefully that will then help with some of the comments that we've had coming back. From a wider perspective on the reviewing side, again, it's been a very, very busy year. We do anticipate normally a drop-off of reviews in quarter 4. Typically, this is more because we're finding that the complexity of some of the incidents that we're reviewing do take longer. So we're then getting some of the reports coming in towards the end of the year. But also we're looking at different levels of reporting, different levels of reviewing, which then means that we can focus on other areas and not just on the technical incidents, but we also look at programme lessons learned. So at the last meeting we had the NHS Wales app review, which Matt Cornish came to the last Digital Governance and Safety Committee to also run through. But also we had a patient safety review, which I've reflected within some of the summary bits. Across the year, we had 33 reports in total. 20 of those were related to technical reviews. But we then had as I said before, had some lessons learned reviews. We've had a couple of patient safety reviews, and also we've had a couple of thematic reviews where we've taken not just individual incidents, but almost where there is a common theme that we've identified. We've looked at multiple incidents across the piece to identify wider learning. Compared to previous years, again, the technical ones really take up the bulk of the work that IRLG provides or produces, but it's been very much a mixed bag outside of those, and as I've said, it's a combination of different formats that are coming through. On the learning front, I've included summaries from 3 of the reviews that we've had. One is a network services technical review. So this was around inconsistency in the approach that we've taken for change management. What we've done to follow up on that, and we've noticed a little pattern that we're focusing our improvement workshops around ensuring that people are following a documented process, but not just looking at going through the process itself, but actually working with the teams to understand the reasons why they may be missing steps within that process. So it's also looking at the human factors behind it and not just going, the process needs to change. That we found is starting to build a cultural change within the organisation. The other 2, the second one again was a Welsh Clinical Portal review, and again this was around the inconsistencies with change management, and then the last one was patient safety review around the Welsh Laboratory Information Management System, and this provided wider wider reflection. So it wasn't just focusing on the technical requirements, but also looking at the commercial aspects, and also the ways of working within the individual health boards around the laboratory staff. So again, it's not, we're now not just also not focusing just in DHCW, but also providing recommendations of improvements to how we work with the individual health boards. The learning, so again, continuing with the learning on the contributory factors, we have, despite what I've said about change management, we've actually had a decrease on the last 2 years around the active domain for contributory factors. So the active domain is where is almost like a human failure of approach. So where a process may not have been followed and it was down to human error. So again, through that engagement within the organisation and the approaches that we've taken, we're noticing that gradual decline on previous years, which is a really positive thing. But we've also seen an increase around the departmental domain. So this is around the complexity of the systems, the infrastructure, the applications, the data transfers, and the software. And we've been doing some work around problem management to try to reduce those. It's one of those areas where we, with the investment in systems and the ever-growing complexity and the integration between those systems, it can lead to some faults coming in. So it's an area that we are consistently looking at. And then the other area of increase is around the external domain. So this is with supplier-related issues and also the issues that are within the health boards. So we've embedded some of the improvements that we've been looking at around local health board engagement and supplier engagement to bring accountability to the supplier through the commercial processes. And again, this is something that we're working up, and we're seeing some gradual improvements. So again, it's an area of focus that we'll be looking at for next year. And then the last area around the improvements, I've covered off a lot of them. There's still some ongoing work that we're doing around major incident management and the training out of the processes. As I've said before, we're improving the relationship management side. And also we're then looking at things like the greater understanding of business impact. So we've got an improvement there around the review of the clinical impact. But that can be taken forward to understand just not just the clinical stuff, but for the wider business, so financial impact or commercial impact. So it's again, it's an area where we're constantly looking. We've got membership now on the group from commercial services. We've got very good membership as well from the clinical team. So they're feeding into the reports and they're feeding into the reviews, and they're going out and they're sharing the lessons learned. The last bit that I just want to cover off is going all the way back to the SWOT analysis. So some of this we ran a workshop at the end of April. We are still going through a lot of the findings, but generally we ran an efficiency survey. We had very high scores around the reporting and the reviewing. There are some improvements that we can make around the wider learning outside of core reviews. So outside of the technical reviews, there's wider learning that we can make. I was on a call today around the staff survey. The incident review learning group came up, and outcomes from the staff survey is, okay, how can we embed that learning through IRLG so that we can embed it further into the organisation? I think the general feeling from group members is that we have a lot of contribution within the meetings, and we have a lot of expertise coming out from across the organisation. They liked the fact that wider organisational learning and the fact that the IRLG reports into this committee means that we've got that buy-in not just from the independent members, from yourselves, but also from Helen and the exec board. So for them to understand that and to then go, okay, we support this, is very, very good news for the group. And the only other thing that I want to just cover on is that we have got some weaknesses around technical challenge, and some of the scrutiny of the reports with a member of my team. He turned around in the meeting, he went that he plans to come in to be challenged, and there are times where it's almost a disappointment for him that we're not asking him really, really difficult questions that he's anticipating. So I think myself, Michelle, and the rest of the group have said to him, okay, well, when you next come, we are going to press you on some of the areas. So I think that's everything I want to cover up. As I say, I want to provide a fuller view in the next meeting with a lot more of the finding, but we've got the meeting in 2 weeks' time where I want to have an action plan come out from that. You're on mute, Chair.
Thank you, Keith. That was an excellent summary, and just wanted to commend you as well, because the annual report in the appendix was really high quality and really well produced. David, you have a question?
Yes, thanks, Ryan. Thanks, Keith, for that update. I just wanted to probe a little bit more around the increase in complaints, concerns and feedback that we had in Q4 to 72. You mentioned in your commentary some of that was driven by queries around the NHS Wales app. My memory might be failing me, but I thought previously we had a peak and we then chose to route those particular queries to a different to the service desk, I think. So I'm just, did I remember that correctly, or are we now seeing different types of complaints or concerns coming in to you as a result of the app?
Shall I answer that?
Yes,
Dave?
please, Radio.
Yeah, David, the ability of an individual to access Digital Healthcare Wales continues to impress me, because you close one door and apparently there are 3 or 4 other ways to get in, and you close those doors and there are other ways.
All right,
to get
okay.
in. So I think this just reflects the fact that,
Okay.
like many of us probably who try and contact the NHS, you try one number and then you try another number and
Okay,
another number.
fine.
So I think
All
that's I think that's what it relates to.
Okay, all right, thanks, Bridget.
Sam, if you could.
Thank you, Chair. I'd just like to thank Keith for the report. I think it's really important that we focus on these learnings. You know, we are a learning organisation, aren't we? And we need to step back and reflect on what these messages are really telling us. I think we're seeing change-related failures. We're seeing incidences of failures related to complexity. So, you know, in the bigger picture, there are things that we can and should and are doing in order to reduce the incidence of those, and those would include things like trying to shift left some of this work, so embedding assurance into the deployment and build processes rather than doing it afterwards. You know, the work of the TDA that we'll be hearing about later, which is looking at establishing principles, standards and blueprints which make it easier for people to deploy things in a pre-tested and compliant way. Test automation to try and ensure that we're embedding testing all the way through the build of a product rather than doing it at the end, doing the same thing with cybersecurity testing. You know, these are the things that are going to address any systemic issues that we've got in this space, and will over time reduce the incidence of these kinds of situations.
I think that's a really helpful comment, Sam. And you know, we are dealing with very complex systems. So, you know, this organisation has to have complex system handling muscles, because that's what we do. So it's really good to have this focus driven by Keith. Laura?
Diolch, Chair. Laura Tolley, Head of Corporate Governance. And I just wanted to come back to David's point around the inquiries. So you are right, David. We did put a different route in place for the inquiries relating to the NHS app. But there is a specific distinction between inquiries and complaints. So we have around circa 100 inquiries a week to the service desk on the app, which are dealt with by the service desk team. But if members of the public wish to log a formal complaint, which is different, then that comes through to the corporate governance team and is logged as such and handled in line with putting things right regulations. So that's the distinction there. Diolch.
That's really helpful. Thank you, Laura. Okay, well, thank you very much, Keith. Excellent report and a good discussion. And thank you for the assurance. Darren, can I call on you next to talk about the Information Governance Assurance Report and focusing on the Welsh IG Toolkit, please?
Thanks, Chair. Yeah, I'll take each of those in turn, and then I'll pause in case there's any questions between any of those three items, because they are slightly separate items for obvious reasons. So the main IG Assurance Report, as usual, is set out in exactly the same format in terms of our compliance across AIM 1, 2, 3, and 4. You'll see in the you will have seen in the report in Appendices 1, we talk about our actions against our toolkit submission for 23-24 and what we've achieved there, and some ongoing actions around that. One of them, in terms of completion of one of those actions, is actually as part of the paper, and 4.2.2 in terms of the publication scheme. And then our performance around our Freedom of Information Act responsibilities, subject access request, and then any incident management handling as well. So that's the aspects in AIM 1 and Appendix A. Appendix B, just to highlight to the committee about the role again of our wider role in terms of ensuring that IG assurance is across all of our services, systems and services, both our ongoing commitment to existing ones and new ones as well. So a huge variation of data protection impact assessments that we do, and some stats around working on 36 currently. 11 started and 9 signed off, but that is a continual churn and a continual factory line of data protection impact assessment, and that's part of our wider, as you know, our wider assurance process, which Laura will no doubt come on to talk about in due course. And then some aspects of where our information governance calls come in as well via our DPO service functions and other functions as well. Knowing that we do tend to have a peak around the March period, because that's when the toolkit submissions have to come in through health boards, trusts, general practice, community pharmacists, etc., and the age-old, I suppose, the age-old behaviours where those are tend to be done towards the back end of that 12-month period of trying to get those kind of over the line. So we have a higher volume of calls when the closer the submission date comes. But that's well within them understanding. So that's
similar to the tax office encouraging me to make my tax return well before the end of the year, I suppose.
That's correct. And then Appendix C, which talks about some of our associated risks we talked about earlier as part of those corporate risks as well, and so just encapsulating some of those things around the statement of intent work and some of those other external factors that we need to help in terms of clarifying policy within the wider service. So that's those items in terms of the main body of the report. Are there any questions from that bit before I move on? No.
No questions. I think it was incredibly clear. Thank you, Darren.
Thank you. The other item then, which is 4.2.1, is the IG Toolkit submission for 24-25. You will notice there are a number of areas where we are scored against in those areas. You will see there's some variance from previous year, downward trend on some of them in terms of the exceeded items. That's as a result of some slight changes inside the question set. So there's a slight increase in expectation on where performance needs to come and where the baseline is on those things. That's through consultation with a wider service in terms of increasing that, and understanding where aspects of guidance come from the ICO and the law as well actually bring in. So every time we have an annual submission of the toolkit, there's always a small variance of those question sets. But it doesn't mean that our assurance has reduced or our compliance has reduced. There's just a slight variance in where the bar has been raised slightly in terms of some of those areas of guidance and law have, not necessarily the law, but some of the guidance has changed. The one aspect to be aware of, we've gone up in terms of minimum expectation around training and awareness. That was as a result of us doing more thorough things across the organisation, not just our statutory and mandatory, but it's our awareness raising in the organisation, those type of things, which give us an increase in score in terms of some of those minimum expectations. So we're fulfilling that in our 24-25 toolkit. So that's an ongoing. We have an action plan now in order to fulfil some of the other things where we have to pick up our, where we recognise where there's other areas of work of improvement inside the organisation, but effectively to give the committee some assurance where we are exceeding a lot of expectations in terms of the measurement of the IG toolkit across Wales. Any questions on that before I move on? Because in this publication scheme, I think is the next paper.
So Darren, just a quick question for me. You've seen the variance in expectation exceeded decrease, particularly in risks and data protection impact assessments and freedom of information requests. Is there any aspect of that is due to a lack of resource?
No, it's an issue with a question change rather than a lack of resource or a lack of compliance. All toolkits across the board in the services will see a dip in that because of we've moved the goalposts in short order across the board in terms of how we're measuring it.
Excellent. So the goal's smaller and so's the ball, or something like that.
Yes.
Excellent. Okay. Just wanted to clarify that. Thank you, Darren. Did anyone else have any questions? No. Okay. Shall we move on to the publication scheme?
Yeah. So this is a prerequisite of all organisations to have a publication scheme. This is on the back of the Freedom of Information Act, and one of the sections within the Act to have a clear line of sight in terms of roles and responsibilities and what the organisation's functions are. Coming back to functions again, there seems to be a popular word today. This is to assure the committee that it's not that we haven't had a way of demonstrating that. That is just increasing our compliance. So we have put areas of defined areas of what we need to do as or what they call as classified information in one consolidated area within our website. So we're linking to the things that we already have, but it's in one consolidated way, which follows the ICO's guidance to the letter now in terms of the classifications. Those classifications are who we are, what we do, what we spend it, and how we spend what we spend and how we spend it, what our priorities are, how we make decisions, our policies, procedures, lists and registers, and other services we offer. So what that does now is bring it into a template within our website that allows individual members of the public to hit those questions and then propagate out into the information that we've already established within our very helpful website effectively. So that's live. We've done that. That ticks our toolkit element in terms of one of the actions from the toolkit. And we've been working closely with our corporate colleagues in order to get that done, because that's just been able to link those component parts. We'll have responsibility for actually making sure that's maintained and in line with the ICO guidance as well. So, like I say, the component parts were there. We were just consolidating them in the template that the ICO recommended that all organisations adopt effectively.
Laura.
Diolch, Rowan. It was just a quick comment. It's great to see the comprehensive publication scheme live on the website, and just a note of thanks to Marcus Sandberg in the information governance team, who really led this work collaboratively across the organisation, bringing everybody in together, understanding the ICO requirements. Not an easy thing to explain or bring people on the journey with you, but he did a great job and it's a great outcome. So thanks.
Thank you, Laura, for highlighting Marcus's work. David? you have a question.
Yeah, thanks, Rowan. I'd like to concur with Laura's comments as well. It's a good piece of work. I just had a question about the reference in paragraph 4.5 to undertaking a review to see if there are any gaps, which I think is commendable. What's the timeline, Darren, for carrying out that review? So when would we know if we've got gaps and then develop a plan to fill them?
I think it makes reference to the prior gaps that we had, and now having plugged those gaps.
So right, okay.
I think
we don't have any gaps.
I think that's past tense rather than present
okay.
tense. It's probably just maybe a wording in that. So just for apologies if it is the wording. It's the fact that we had all those components. They hadn't necessarily been accommodated in those components. We now have that. Publication scheme is live. Gaps have now being filled effectively.
Right, so I thought we were doing a further review. Yeah. Thanks for the clarification.
We are committing to reviewing it though, so we will have an established review on that to make sure that we're not inadvertently, because as you know, once these things go live, quite quickly they go out of date at the same as well. So we have to make sure that we commit to reviewing them.
Okay, thanks, Darren.
Thank you, Darren. Okay, that was very helpful and very timely, so I appreciate that, Darren. Rachel, could I ask you to provide the Information Services Assurance Report, please?
You can, and apologies, I've just realised it's got Darren's name against that particular item on the agenda, but don't worry, Darren, I'll save you the pain of having to cover my item. So I just wanted to start off with the milestones in particular. We consistently report good compliance against delivery of our milestones, and that was certainly the case for Q4 of the IMTP. And we delivered all milestones bar one, which was carried forward into this year's plan for Q3. And actually that particular milestone that was reforecast in the plan, it was a very low priority one. We consulted with the external stakeholders involved, and we put an interim solution in place. There was no issues with regards to that at all. It was just rescheduling and reprioritising some of the immediate work that we needed to focus on. Since the beginning of February, the ISD Assurance Group have reviewed 6 quality assurance plans and 1 quality assurance plan extension. We've also reviewed 3 safety case and readiness reports, and that's really just to make sure that all the information, the necessary information requirements are captured and considered by projects, teams and individuals as part of the work that they undertaken. So that's all working to plan. The corporate Power BI team, and again, I've spoken about this in previous committees around the work that we do around corporate Power BI assurance, both in the development of corporate Power BI dashboards that we do within the team internally, but also around providing that broader assurance function to the rest of the organisation. And there's quite a lot of work happening in that space. And we've received 84 approval requests that have been submitted and processed. So the team are quite active in terms of ensuring that not only are the products that we produce compliant with the policy that's been signed off, but also that external products that are being developed outside of our team are also compliant. And there's actually an audit that's still underway to make sure that everything that's published, both externally and within NHS Wales, is completely compliant. So we're also looking at existing products that have already been published and are out there. So we're doing a bit of a retrospective review as well. So team are very active in that space, and we're working with individuals and teams as well, where we identify particular skills gaps or perhaps areas for development. We'll provide some additional support and some training just to fill that gap. We've done quite a lot of work, and there's quite a lot published on my website as well, which I've shared previously, so colleagues are welcome to go and have a look at the publication scheme that we've got in terms of where official stats publications, as well as all of the dashboards that are published, as well as what's in development. But just a few highlights from the report. We've got the specialist palliative care form that went live in February, the synonymised cancer data for calculating quality performance indicators that's been supplied to NHS Executive, and we've released the preoperative anemia dashboard as well. So quite a lot happening in the space, but we just wanted to give some examples of some specific work packages that we've taken forward. I was going to talk a little bit about Audit Plus, but we covered that earlier in the agenda, so I won't repeat what was said earlier, but obviously some good progress happening in that space. But again, a refreshed focus on what we can do to mitigate the risk and now divert our attention to developing that in-house solution as well. So I'll pause there for questions.
Excellent. Thank you, Rachel. David, you have a question?
I do. Thanks, Rowan. Thanks for the update, Rachel. First thing is there's a lot of great stuff that the team are doing, so I commend you on that. My question really is, given that we're starting to grow what we're doing in this space, which is great, but we've also got this Audit Plus issue, which will require resource. The demand on your team and the fact that we have to do this solution for Audit Plus, do we have sufficient resource in your area to continue to do the good work you're doing and cover the Audit Plus problem we've got?
It's a really good question. Thank you, David. My team would probably say no. We always need more resource. But if I'm being honest, we're very ambitious in terms of how we can constantly improve our service. We're always looking at what's over the horizon. I was really fortunate to attend a conference last week and took a lot of learning from that, and really considering the profession of data analysts that we have within the team and how their roles are going to change over the coming years because of advancements in AI, etc. And what's coming over the horizon. So I think we're always, not only looking to expand capacity where that's a requirement, we're also looking at how we can change the way that we work and really incorporate some of the modern tool and things that we'll have available through the likes of Google Cloud Platform as part of the NDR program. So we're very passionate as well about keeping our skills up to date, and there's been a lot of focus in terms of the development of our team and our function as well. So in a nutshell, more resource would be lovely, but we're also very practical, and we realise the constraints in the system. So we're always thinking about how we can work a bit differently and how we can really lean on those tools to find more efficient and different ways of working as well.
Okay, fine. Just a supplementary for me. So the constraints, are they budget constraints, or are they our ability to recruit the people with the right skill sets?
Typically it's budget constraints, and we've been very fortunate in terms of recruitment, David. So we've done a lot of work in that area, and we've got good pipelines of professionals coming in from, I'll use Cardiff University Data Science Academy as an example. So we work really closely with Cardiff University, and we've been really fortunate to get good graduates come and work within our team, and we develop them, and we've been fortunate to be able to retain people and develop their skills, and they've progressed into different roles within the team over the years. So that's worked really well. So we're pretty good at being able to recruit. We've also refined, because one of the challenges that we have, and I'm sure this won't be just exclusive to my team, but we get short-term funding to do very bespoke, specific packages of work. And it could be a 6-month, funding pot to deliver something. Now, if you relate that to a resource, you've got the challenge then of recruiting someone for a 6-month period. So like I say, the links with the university have provided, they've been quite fruitful in that space, because we can recruit on short-term contracts in that environment, although ultimately we don't want to lose good people. So when that funding pot comes to an end, if we've invested in people and we've developed and we see further work over the horizon, ideally we want to keep hold of those people. And if that funding's coming to an end and there's nothing to replace it, then that's not always possible. So recruitment is less of a problem. But the funding, the change in funding situation, and as I say, that's not just my team that's impacted by that, although we've managed to respond, I think, as best as we can to it.
Okay, thank you.
Thank you. I can't see any more questions, so thank you, Rachel. That was really helpful, and I'm just really impressed by how you're using Power BI to fulfil so many needs across the organisation. That's fantastic. So with that, we're 1 minute late. Poor chairing. We have a 10-minute comfort break scheduled. So if everyone would like to turn their cameras off and put themselves on mute, and I'll see you back at 4:25. Thank you. Bye-bye. Thank you. And thank you for being smart enough to realise when I said 4:25, I meant 14:25. So thank you everyone for working with me. Just waiting for a couple more think everyone's back. In which case, we're going to continue with the insurance agenda. And Rachel, please kick us off with the Research and Innovation Strategy Assurance Report.
Yeah, thank you. So again, starting from a milestone and delivery position, we've had excellent performance in terms of milestone delivery, and we delivered all of our Q4 milestones. So that was full compliance for the last year of the IMTP. We delivered all milestones on time, and obviously we've been working really hard to articulate the new milestones into this year as well. So they're all present within the new plan. Again, I've previously reported a risk with regards to commercial capacity within the organisation. So this has been a really big area of focus for the R&I function. We commissioned an external partner to work with us on developing a commercial partnership strategy. That's been almost finalised, and we're taking it to management board next month, hopefully. But essentially, there was a bit of a review of the current arrangements that we have in place within DHEW, and also looking at the pipeline of work typically coming through the R&I function in terms of all of those partnership agreements and what they look like and what arrangements we potentially need to have in place going forward. So we've worked extensively with a lot of stakeholders across the organisation, some external partners, and obviously Informed Solutions to help us derive that commercial partnership strategy. And we've got a number of template contractual clauses and a bit of a process and a way forward for how we can hopefully reduce the burden on internal teams. So the current status is everything is kind of funneled and goes through to a particular team, whether it's fairly straightforward and low risk and low value, etc. Everything's funneled through, and we're creating quite a backlog at the moment for all those agreements that are just getting clogged up, and it's frustrating and not good reputation as a function that's trying to start out and get a good reputation. It's not something we're very proud of. So it's really good to try and bottom that out, and a lot of work's been done to date on that. So that's a really positive thing that I wanted to report on. From an engagement perspective, we've spent quite a lot of time working with engagement teams within DHEW to have a really proactive approach, and we've developed an engagement strategy and plan. And I attended BioWales London in March, and also I participated in an innovation exchange event with NHS Scotland, which was really important because we were managed to glean a lot of learning and share our experiences within Wales, but also, some great take homes from Scottish colleagues, and really harnessing those relationships to work more collaboratively in the future. But from a personal perspective, it was really useful from my perspective, because it's given me some really good points for how we can furnish our research and innovation strategy, because we've got the refresh scheduled for Q3 of this year. So I know that the internal team's working hard to try and capture a lot of the intelligence from those engagement events, and to make sure that we pick that up and articulate that successfully in the refresh of our strategy going forward as well. We've set the projects out within the report in a slightly different way. So we've tried to categorise them, because appreciate was the focus is around assurance. We wanted to give a flavour of the type of work that's going through the R&I governance that we've established. So we've and it can be a little bit disparate in terms of some of the smaller scale things that we're getting involved with, from letters of support right up to some of those larger collaborative projects. So we've tried to group and present them in the report in a slightly different way, and just categorise them as collaborative project or R&I projects, clinical trials and pathfinder studies, and some of the sale data requests that were routinely being asked to progress. So hopefully that's a cleaner way of setting it out, at least. And then I'll pause there, because there's an awful lot of detail within the within the annual report for information intelligence and research. So I didn't want to particularly go through a lot of the case studies that we've described, but yeah, I'll pause there for now.
Chris, could I ask you can ask a question, I think?
Yeah, thank you, Chair, and thank you, Rachel. It was just a comment more than a question, probably, around the input around the commercial approach. And I think the team are to be commended for getting some external support in on this. We are quite unique organisationally across the system. This is a new area, isn't it, for DHEW, and we've been on the journey. So I just think getting this right from a partnership arrangements perspective and getting some of that external support, but also challenge about how we do this most effectively, is a really good thing to do. So I look forward to the paper that's coming in a month or two, Rach. But yeah, it was just a comment, Chair.
Thank you. And it's just to comment on that, if I may. Thank you, Chris. And I think we appreciate the additional work we're putting on other teams, particularly commercial, and I'd like to point out information governance as well, and finance as well. So there's although I report and probably get quite a lot of kudos for the research and innovation projects that we're supporting, it is a collective effort across the organisation. I think having some of these internal mechanisms and processes really refined and fine-tuned as much as possible, it's really important for the successful delivery of the R&I function.
Absolutely, Rachel. And David?
Sorry, I've got a question on the annual report. Are you going to come on to that next?
Yes, I will.
Right, in which case I'll hold my question. Okay.
Make it good, Rachel. David's already got a question. Now, on the commercial point, I'm just going to echo Chris's piece. This is a fast-moving area. There are lots more uses for healthcare information in driving research than perhaps we had before. It's a whole new skill set, and it's quite a sophisticated area. So I'm just going to echo Chris's point there, and really pleased to see it. And also, I'm really pleased to see, we're still quite young, but we already have a portfolio of projects which have different, across the board. So you've got NIHR grants, you've got, collaborative reports, you've got clinical trials you're supporting, and we've got sales. So I think that's a really nice mix, and well done. Do you want to move on to the annual report now?
I can do, thank you. So yeah, in respect of the annual report, last year we brought a research and innovation annual report to the committee. This year we've got a slightly different focus, and we've deliberately and purposely broadened the remit of that annual report because there was actually quite a lot of overlap between the information and the data side of things and research and innovation. So as we have mission 4 within where DHEW strategy, and I'm responsible from an IMTP portfolio perspective for the research and innovation and value from data portfolios. I've, as I say, purposely brought those together under one annual report rather than trying to cover off too many different, or reduce the reporting burden as well. So I think that brings a really nice story, and we were able to flourish it with the e-library examples too. We purposely as well tried to align it with the strategic aims from both the information and analytics strategy and the research and innovation strategy. So work closely with colleagues within DHEW to try and format it in a way that made it a bit more meaningful to the reader. And speaking of the reader, the audience, this really is meant to be a bit of an external document as well. So there's quite a lot of enablement and back functions that aren't necessarily covered in the report, but the idea being that potential collaborators, potential partners that we might want to work with in the future can pick this up and really get a good flavour for the type of work that we're taking forward across where respective teams. So as I say, it's not extensive. There's a lot that isn't covered in that report, and believe it or not, it's a job to try and reduce it to the number of pages that it is, but hopefully it gives a good flavour and demonstrates progress against the strategic aims from both those different strategy areas. And then the final part of the report focuses on the forward look. We thought it was really important to set that out and to show a commitment for where the teams will be focusing their efforts over the next 12 months as well. So I'll pause there for comment.
I believe David has a question.
You're right. I got my hand up early. Thank you, Rowan. Thanks, Rachel. So, Rachel, in the report, going forward, you're looking to make more use of NDR as it becomes more richer in data. We have had a bit of a problem with NDR in terms of the escalation and data getting into it. Largely, I think that's outside of our control. I think it's the health boards putting the data in. To what extent is that going to cause us problems going forward? At what point are you looking to exploit NDR and its rich data sets, and is that going to hold you back?
So we're really central as part of that conversation as well, David, because obviously we're trying to migrate the national data warehouse now into the NDAP environment within NDR. So that's been a challenge for us as well, and something that we've been working quite closely with NDR teams to try and unpick and work out a good plan to take forward. Because what I always say is we're making mistakes with our internal teams, and if we can do something that's scalable and that we can share our learning with the health boards, we're happy to be the guinea pigs in some respects. So we've had a lot of learning, because my team were quick to point out that there weren't Google Cloud experts when we procured that particular product. And we've got a traditional on-prem data warehouse. It's large, it works, but there's a lot of legacy wrapped up in that. So just plonking that into the NDR environment creates a lot of challenges for us. But I am pleased to say that we've made some steady progress, and we've been working with some fantastic people of late. So I think NDR have managed to procure some specific expertise in that space. We're happy to do the migration, but what we've asked for is some validation of the work that we're doing. So we've kind of designed a process to move the data from A to B. But what we've been really clear on, we just want someone to say to us, yes, you're doing that in the correct way, and then we're happy to progress and to crack on. So we've had a bit more of that of late. So things are moving forward in the right way, I think. And yeah, we're happy to support health boards in their journey as well. But the honest answer is it's been a lot of learning for us as well. So I think we underestimated at the start how big a challenge it was, and it wasn't until we were given the keys to that environment that we realized, wow, this is a big tall ask. But actually I think we are making sufficient progress in that space. And what's really heartening is that the teams are quickly developing the skills in that Google Cloud environment as well, which is good.
Okay, thanks, Rachel.
And Rachel, can I ask you just to indulge me, and for anyone who might be wanting to explore collaborating and on an R&I project with DHCW, how can they get in touch, and who should they contact?
If you go onto the DHCW website, you'll find an R&I page. It's just recently been launched, and there should be an email address there. I don't want to get it wrong and say it off the top of my head, and I probably will. So I'll encourage people to go onto the DHCW external facing website, find the R&I page, and there'll be contact details to get in touch, and we can guide you through the process there. But yeah, we like I say, the range of projects we get involved with are quite broad. Ultimately, we want to satisfy some prerequisites. We must deliver value back to Wales. There's a lot of criteria that we need to fulfil, but yeah, we're happy to consider a range of different projects and make sure that we're really bringing value back to the system. So please do get in touch.
Fantastic, thank you, Rachel. And thank you for that report. So moving now on to the Wales Informatics Assurance Group report. I'm delighted to ask Laura Beddoe to step up and present this one. Thank you, Laura.
Thank you, Chair. So I'm Laura Beddoe, Quality Manager, Regulatory Compliance. Just want to raise a few key points from the report. So section 4.1, we look at go live compliance. Now there was one project that didn't receive full WIAG assurance before it went live. So the Integrated Radiotherapy Solutions project. However, it was given exec approval for it to go ahead. It worked with Velindre, so Velindre were aware of what the risks were, so the decision was to go ahead. Since writing the report, both information governance and patient safety have given their approval. Testing is still waiting for final evidence. I have checked with the testing assurance lead yesterday, and they still haven't received it. the project managers out of the office today, so I couldn't find out what the latest information was on that one. But it was interesting to hear about testing automation being raised, because testing is always the last assurance piece for our group, and it's always the one then that everything is done, 19 out of the 20 is done, and testing then is where when everybody has to pause and get that done. So to hear if there's potential changes would be really interesting for Wales Informatics Assurance Group. Another point I think interesting to raise is that we had our first completion of the electronic prescribing and medicines administration, so EPMA. So WIAG, we were asked if we could give advice and guidance to the health boards. As an organisation, obviously we have expertise in rolling out large digital solutions, and WIAG have been requested to provide this additional advice and support. So Cardiff and Vale were the first that came through. They were our guinea pigs. It was it was interesting for us watching it, operationally managing it, for the project team in Cardiff and Vale, and for the assurance leads, because obviously the group has been running in the same way for many years, and then the health boards were coming in for EPMA, and we were very much having to rewrite what we were used to asking. So where you say you must complete this, no, so we were advised that you do that. So there was a bit of a learning internally for us as a group. I think few of us stumbled on it a few times and continued to ask the same questions. Then we had to go back and rethink and actually think, no, this is not what our remit is for this. So it was then interesting for the health board to have to be providing us evidence, and they were questioning what we needed to do. But there's a great team within DHCW that we work with, obviously provides EPMA with support. So we work really closely with them, and all the work that Cardiff and Vale then is now being cascaded through the other health boards. So as they're coming through, they're aware now of what the expectations are. So Cardiff and Vale did have the pain; they had to go be the first ones. But yeah, I think for the rest of the health boards, then it is going to be much smoother for them, so they have an awareness of what's happening. So that was quite a key thing for us to get that one over the line. So we were pleased with that. And then section 5.1, I've raised it a few times, so just to let you know, progress with the Power App. So we have over a dozen projects has gone through now, and we're gathering a lot of feedback on it, whether from project managers or from the assurance leads. I think from the project managers, we're getting much more positive feedback. They are enjoying certain aspects of it, not having the duplication of writing things that they previously would have in the original process. The assurance leads, I think they're finding it different because they've been doing the same process for maybe 10 years. So we held a meeting last week with some of the assurance leads where we looked at the processes, we looked at things that we could improve, because the Power App was planned to mirror what we were doing. And now that the Power App is in place, they're now looking at how we can actually make improvements again and how we can change things. But as well as looking at improvements, they're looking at the gaps, and they're thinking, because the project managers are not coming to WIAG as often as they can, you kind of lose that human element a bit. If there's slight changes to scope, we want to make sure that we're not losing the communication that we would get when we were bringing the project managers to the group 3 times during the life cycle of the project. So we're looking at those kind of things. We did pick up initially some of the projects that were being submitted through the Power App. There was a lack of information, so we were worried then, was it the Power App was then throwing people and we weren't given enough guidance. But I think what we've kind of worked out is that it was 1 or 2 newer project managers who weren't quite sure what they needed to do. So we don't think that's impacting the quality of information coming through. So it's been interesting. What we've since been asked since writing the report is to look at WIAG slightly more widely. So we're looking at how it interacts with other assurance groups across the organisation. So we've already met with members of technical design assurance group, looking at maybe if there's any areas of good practice, anything that we could basically pinch and use. You know, if somebody's got a great idea and it's working well in another group, could we use that? We want to make sure that the links between our group and the other groups are working seamlessly, that the information is being shared appropriately. So what we're going to be doing is we're going to be running a quality improvement activity over the next quarter or two on the full WIAG processes. We're looking at what we can do, where we can streamline things, because we know one of the things WIAG gets picked up on is that it can slow things down. We want to be looking at how we're making sure that the assurance process still remains safe, but where we can be more agile and be more responsive to changes to various projects that are coming through. So there's a lot of work that's going to be ongoing over the next few months that we're going to be looking at. So it's going to be quite interesting. And we've got a lot of buy-in from the assurance leads. They're very happy. And I will be having a conversation with the project manager. So I'm going to be reaching out to the project management team and seeing who wants to be involved, because I'm sure we want to get as many key stakeholders involved to make sure that if we're going to make changes, that they work for everybody. I'll pause there.
That's fantastic, Laura, and thank you for that report. And also talk about living example of this being a learning organisation, both delivering and learning as we go and reflecting that. So thank you for that. Any questions for Laura? No? Excellent report, Laura. Thank you very much for that. Oh, Ridian, sorry, one. I almost missed you.
It's a comment, actually, as just to put on record my thanks for the work that Laura does leading the delivery of these reports. It can sometimes seem a thankless task, Laura, so I'm putting my thanks on record. Thank you very much.
Thank you, Ridian.
Thank you, Ridian. And Darren?
Just one quick comment, Chair, in terms of the importance of our assurance model, in terms of it from my perspective, from a data protection and a patient safety perspective, is to ensure that we've got all of those areas covered. They are extremely important from my perspective. You know, we've demonstrated that through the report that I provided from an IG perspective. But there are some key areas that we have to make sure that we are robust on, and this is the assurance element. It does ensure that anything that goes out the door has that element of robustness and transparency to it. So any improvements, really supportive of that, any improvements, but we should ensure that we keep the continuity of making sure that that assurance process is as robust as it can be, because we've got a responsibility to both the service and the public to make sure all of those things are in place.
No, I couldn't agree more, Darren, that you know, we've got to have the evidence that we do what we say we're doing, and as well as doing what we should do. So understand Laura's in the hot seat there, but also loving the way that we're supporting other organisations across the NHS, and yeah, we've got a bit of learning as we go, Laura, but we've grasped that nettle, I think. So the last assurance report now is the Technical Design Authority Assurance Report, and I understand Sam is going to be Chris Collis's understudy today. Sam, you are presenting the Technical Design Authority Assurance Report.
Thank you. Okay, so the Technical Design Authority was established about 18 months ago, initially as a pilot, but then subsequently formalised as a permanent board. It contains representatives from within DHCW, so all of our heads of profession and technical experts are in the body, but also we have representation from Welsh Government and from Aneurin and Bevan. So the idea is to not be entirely DHCW centric, and also to be looking to use this as the basis for wider architectural governance, which may be coming down the road in the future. The TDA has been instrumental in defining the architectural domains that we use to structure the work that we do and to establish a robust enterprise architecture framework. And then we review and approve architectural principles that are defined as well. The TDA derives its authority from the management board, and its main focus is on establishing and maintaining architectural decisions, which are generally in the form of principles, standards, and reusable patterns or blueprints. So as per the conversation earlier about shifting left and embedding assurance in delivery, this is really the purpose of the Technical Design Authority, is to make it as easy as possible for product teams to do the right thing by providing as much of that information up front and smoothing out the assurance process. Because if you can demonstrate that you followed the principles and standards set by the TDA, then assurance is essentially predetermined, or certainly much more straightforward. The TDA works by defining working groups which are aligned to the architectural domains, and then we commission each working group to go away and develop the principles, standards and blueprints in each area, and then bring those back to the design authority for ratification, and they then become written into our architectural record. There's a dedicated technical design assurance group which reports to the TDA. So the job of the TDAG, as it's known, is to assure individual designs against the architectural decision records that have been defined through the TDA. So there's a clear kind of hierarchy of definition of standards and then assurance against those standards. Since the last report to this committee, we've actually established 2 additional architecture domains. So we've established one user-centered design domain, and we've also established a clinical domain. Obviously, it's really important to have standards defined in both of those areas so that we ensure that our technical designs take those into account. The security working group has defined its set of principles, which have now been ratified. So that is adding to our architectural record, and the user-centered design domain have drafted their initial set of principles, and those are under review by the TDA. We've also started a bit of an initiative to do much more of the work of the TDA in the open. So we've adopted GitHub as our repository. We've started publishing architectural decision records in GitHub, and we are now also publishing all of the principles and standards in there as well. That's publicly accessible. So the idea is, we want to, this is digital best practice, isn't it, to work in the open. So we're very much committed to doing that, and that's something that we intend to do much more of going forward as we adopt our new operating model. Additionally, the remit letter, which we've recently received from Welsh Government, is very clear on the importance of the development of the national target architecture. So the TDA will play a key role in doing that. There's a number of ways through which that will happen. So one of the things that we've recommended in our conversations with Welsh Government is that nationally there should be established a national architecture board, which will be part of the formal DDAC governance, which is currently being put in place. We're recommending a decentralised technical design authority structure as well, where we're proposing, or we're suggesting, that each health board should have its own technical design authority, which reports up into the National Architecture Board. We've offered for those to be based on the DHCW model, if that's helpful. We expect the National Architecture Board to be working to define national architecture standards. So in a similar way, it would be responsible for that very high level determination of standards, but not assurance of individual programs against those standards, because that's going to be very burdensome at a national level. And as I say, hopefully the existing work that we've done can be used to accelerate that process. As part of the National Target Architecture work, we've recently awarded a contract for a partner to come in and work with us on the development of a target architecture for NHS Wales. That contract was awarded last week, so it's pretty hot off the press. And the plan is that by September, we will have a high-level target architecture nationally. We'll be working closely with our Health Board colleagues to develop that. And then by December, we'll have a strategic outline case for the delivery of that national target architecture. Thank you. Happy to take any questions.
Excellent understudy work there, Sam. I think you might have the job permanently. Question from David, please.
Thanks, Sam. This is a good news story which keeps giving. So thank you for the update. Glad to see we've got a supplier on board. That'll help. Just what's the situation with regard to internal resource that we need to work with the supplier? Do we have that in place, or have we got a plan for getting it there?
Thanks, David, for the question. We have we've brought in, or we've reallocated program resource in order to help us coordinate the work. The expectation is that a combination of our internal architecture resource and the additional scale that the supplier will bring will enable us to provide sufficient technical expertise into the project. And so we've scaled up the project and program delivery so that we can coordinate, but we've got the technical expertise with the supplier on board as well.
Good. Okay, thanks. One supplementary, if I may. So, in terms of funding for this activity, we've got, as part of the remit letter, I think, funding that covers us for this financial year. There's likely to be more that we need to do going forward. So, how, in terms of resource, are we able to commit to the resource we need, knowing that we've only got 1 year's worth of funding for certain, and expectation is we'll get more next year, but I'm just concerned that we may have some temporary resource which we'll then struggle to get to retain afterwards.
Yeah, I think so. The development of the strategic outline cases the development of the target architecture kind of blueprint and the development of the strategic outline case are the focus for now, and that's how we intend to use the money that's been made available by Welsh Government. So any further funding would be dependent on that strategic outline case being agreed and us then taking forward a number of initiatives which would then deliver the target architecture.
Okay, fine. Okay, yep. Thanks,
essentially, this is a design and specification work stream, if I've understood that, Sam.
Exactly, Rowan. Yeah.
Yeah.
Brilliant.
So if I could just give some context. So having designed it, it's useful to have the people that designed it then carry on implementing it. So my concern was, can we hang on to the resource with the expertise that did the upfront work when we come to do the implementation? Okay, thanks.
That would certainly be the ideal outcome, David.
Yeah, okay. Been there before, got the scars.
Thank you. And Alistair, if I may ask you to.
Thanks, Rowan, and thanks again, Sam. That was really helpful. The National Architecture Board is very clearly is likely to become an extremely important part of the way in which this moves forward. And I appreciate that these discussions are in play just now, so there'll be a limited amount that you can tell us about. But I wondered if you have any indications as to what the construct of that board would be, just in broad terms, and separately, how do we ensure that the strategic direction it takes aligns with the strategic direction that we're already taking within DHCW? In other words, would there be in the development of the National Architecture Board any risk to the direction we've already started taking?
Yeah, thanks, Alistair. I think the construct of the National Architecture Board remains to be seen at this point. I think the way in which the governance is currently being established, and Chris may have a later update on this than me, but essentially the National DDAT Leadership Board is the initial body that Welsh Government are overseeing, which will be the top level of the new governance framework. And then subsequent to that, there will be the establishment of additional boards, one of which we hope will be the National Architecture Board. We're also working with Welsh Government on the establishment of a Cyber and Information Governance Board as well. So there are additional components of that governance structure which have yet to be established, but I think we know kind of roughly where they're going to land. So how that exactly will be constructed, I'm not sure. I think we've probably got ideas of who we would like to see on that board and who would need to be on it in order for it to be successful. And then the strategic direction, I think that will really be determined by the national target architecture work, which we will do collaboratively across the system and which we will obviously have a significant input to as well. So I think, that's going to be crucial in determining a target architecture which is strategically aligned with the national direction of travel, which takes into account DHCW's existing strategy, and then really that board will I think oversee the delivery of it. Thanks, Alistair.
Excellent. Thanks. And Chris?
Thank you, Rowan. And yeah, I agree with what Sam's just said in terms of the national governance. I think the delivery board will be the next one underneath the DDAT leadership board, which will be mainly around programme delivery. There's a spotlight around programme delivery across NHS Wales. And then hopefully from that, the architecture, cyber and others. We have shared some information with Welsh Government, informed by Mark and other members of Sam's team. So from our perspective, trying to align things strategically, I think hopefully they know the perspective we're coming at from what we hope to get out of those national boards. It was just a question for Sam, actually, more internally focused on the Technical Design Authority, because it's a new way of working. And I know Sam was really keen when he joined DHEW to get this in place, and it's great that it's there. But I just wanted to ask if this new way of working kind of change in mindset, if there's been any resistance, and what some of the lessons have been from having got to where we are now. I know we're still relatively early days.
Yeah, thanks, Chris. I think, yeah, I mean, I'm not sure I've seen any resistance yet. I think the organisation is kind of embracing the direction that we're trying to take, and I think the prize here is much more streamlined governance, isn't it? Ultimately, and much reduced time to get things done. So I think that's a message that's positive for everyone. So I think the main lesson learned really at the moment is, I think, just the complexity. There are things that we would love to be able to do, but it's with the systems and ways of working that we currently have, those things take longer than we perhaps initially expected. I think it would be nice to be much further forward, but I think with things like the cloud program, which are coming down the road now, that will give us the opportunity to really accelerate some of this and bring it to life, because that's where the ability to deploy from a predetermined blueprint becomes much more straightforward when you're in the cloud, doesn't it? And then some of the work that we're also starting to do on test automation and software engineering, I think those are the things that will really embed this, because we've got the technical capability to make the ambition a reality.
Yeah, I think that's in my experience, Sam. It's everyone likes designed architectures and standards in the abstract until they stop them doing something that they want to do. So ensuring that there is that positive enablement, and you can point to it, is really important. And we're starting from a very challenging place. We've already heard about CANISC, which is based on a technology from the mid-90s. When you've got those kind of legacy technology choices still in the system, then your ability to use the sort of open standards that allow you to spin up new solutions much more faster is limited just because of their age. So I think this is a really positive development. So look forward to hearing you moving from starting to actually doing stuff as well and reporting on that. So great. Any other questions for Sam? Nope. Okay. So thank you for that. I think it's the last of the assurance report. So closing matters. I believe there was an AOB that Chris reminded me of. So this is really a bit of a challenge for me. I don't have an answer. It's more of a question to this group, perhaps to take away and have some conversations and come back. But it really came. It was a thought that passed through my mind during the discussions we were having as a board around the escalation, and some of the challenges, Darren, of getting focus on data questions, which can sound quite abstract. And obviously, because we're in it every day, we're aware of some of the consequences of things being said, decisions being made in terms of expectations. So something might go out in a Welsh Health Board circular to ask that something is being done. For example, I don't know. Everyone's NHS number should be on a letter rather than a case number, for example. And the consequences of those things perhaps not happening because, it means that things have to change at some level. So the fact that the decision's been made and published isn't the same as something happening. And therefore, I suspect that we're aware of those non-compliances as an organisation across the system. that perhaps others aren't, because they've got other priorities on their desk. So I wondered if we could think about what the usefulness might be of looking at data policy non-conformances and reporting them as some dashboard. I don't want to set off any witch hunt or point any fingers, but in terms of improving quality of data as it goes into the NDR, and making it more reusable, it might be useful, and it might serve as a summary just to focus people's minds on these things they need nurturing and they need attention in order to drive the outcomes. So it's just an idea. Everyone's allowed to tell me it's a bad idea, but I just wanted to share that and ask some people. Well, great, Ridian, we've got an immediate comment for you from you. So thank you.
So difficult to break this up. So let's say in high-level principles, absolutely. If you can show variation in data standards compliance, that by inference can have an impact on the delivery of care. There's a big difference, as you said, between publishing a standard being implemented, and the ability to monitor the implementation of that standard. One needs to consider who publishes the standard and directs the organisation to use that standard, and shouldn't they, as the publisher and the body that directs them, be responsible also for the auditing of the compliance to the thing that they've published? And indeed, there is governance already in place for those that do the publishing and the directioning to do the monitoring. I just think I sounded like a civil servant out of Yes Minister there, but I'm hoping that made sense.
No, Humphrey, that was fine. That made absolute sense. And I think that's the real challenge, Ridian. So that's why I don't think there's an easy answer to it. But there was a thread there that I was pulling at, and certainly as perhaps the NDR comes to fruition, we're just going to have visibility to these non-conformances. Just something to think about, and perhaps if at the next meeting we can have maybe a couple of moments discussion on it and see whether there is any corner of that where we are within our rails, right? We're not doing someone else's job, but it would be useful in terms of a focus. Thanks. Ridian?
So just to come back, I think it's important that we set an example as the organisation that is involved in the development of standards, that we adhere to them, and that's within our control, and that is something that we should discuss.
Well, thank you, Ridian, and I'm looking forward to others' thoughts, perhaps at the next meeting. So if we could minute that, and then any other urgent business. In which case, just reflecting the chair's highlight report for the board, which, as papers have already gone out, probably won't hit next week's board. But I do want to highlight the discussion on the risk register, particularly the information risks. Report that we obviously heard all of the assurance reports, and they were, no concerns were raised through those assurance reports. Is there anything else I particularly need to highlight from the public board? I didn't feel that there was anything in particular. No, excellent. All right, in which case I'm going to close this part of the meeting reporting that the date of the next meeting is Thursday, the 21st of August. Don't book your holidays. And there's a 10-minute comfort break before we adjourn at 20 minutes past 3. I'll recommence at 20 minutes past 3 for the private session. Thank you, everyone.